Hello, everybody. I am Dr. Hemanshu Bhatia. I am a consultant interventional cardiologist at Sunshine Gachibowli, and I have been asked on this occasion of World Hypertension Day to clarify a few points about hypertension, especially home BP recording, which is now very much a part of hypertension management over the past decade or so. Because WHO and even our cardiac society also world over, including American Heart Association, they recommend that home BP monitoring is simply one of the best methods to keep a check not only on the existing people who are suffering from hypertension, but also diagnosing many of the new persons who have been affected by this disease. Because what we have known so far is that hypertension usually follows an iceberg phenomenon, wherein the number of cases actually which come to light or detected are actually just the tip of the iceberg, whereas vast majority just carry on the daily activities without even knowing that they have been affected with hypertension. Now, specifically to coming to today's talk, it has been dedicated to some of the fallacies or some of the faults which are usually prevalent while recording the home BP. Because now there is easy prevalence of electronic BP monitors throughout in the market, but recording it correctly, that is recording it in a correct manner, recording the BP in a correct manner is very much important. Now, some of the main things what we come to have noticed especially is that first thing is that whenever you are about to measure your home BP, the first thing is to relax. Okay, so stop taking part in any active conversation, or you should not be on your phone, because even involving yourself in any conversation, that itself adds to about 10 mm of the systolic BP is increased, so you may get a wrong reading. Okay, so this is before you start recording your BP. Another thing which is very common is that you should not record your BP with a full bladder, because the full bladder itself, the sensation of mixturation itself will add about 10 mm of systolic BP again. So you get wrong readings. Then coming to your posture, what you have to always do is never cross your legs while recording BP, because crossing the legs itself will cause an increase in venous return, which will thereby add about 2 to 8 mm of your systolic BP. And you should never record your BP in an unsupported manner. You should always sit on a chair, preferably with the back support, and your legs should be comfortably resting on the floor, because the unsupporting action, or what you can say the free action, or free posture itself, that can also impact the BP recording, and it may increase by about 5 to 6 mm. Then coming to the actual process of BP recording, always what we recommend is that the arm should always be supported at the heart level, because unsupported arm, again, if the arm is freely hanging in the air, that can result in an aberrancy or increase in recording of about 10 mm again. So all this what we have discussed up till now, they tend to add the systolic BP, and you may be falsely diagnosed as having more BP, and this may result in what you can say unnecessary change in medication. Then using this cuff correctly, or the size of the cuff should be correct, because many a time what we see in obese people, if the cuff size is very small, the recording will result in increasing the systolic BP by at least 2 to 10 mm again. So the cuff size is of paramount importance whenever we record BP. And lastly, one of the most important yet neglected aspect is that whenever we tie the BP cuff, it should be firmly tied, and it should be on the bare arm, because your addition of any what you can say shirt or t-shirt or any cloth over the clothing can increase the systolic BP by almost 5 to 50 mm. So you may spuriously record yourself as a very high BP despite having normal pressures. So these are some of the caveats. In addition to that, one additional point which I would like to add is, nowadays all the electronic BP machines, the cups come with the arrow mark. So it is always the tubing has to be kept in the what you can say the diamond shape depression of your arm, and the arrow mark will correctly tell you the tubing where it has to be placed. So many a time what we notice is many of the patients will be recording the cuff, putting the cuff upside down, thereby getting erroneous result. So these are some of the caveats which I would like to bring to notice of our patients, and also to those who are listening, that these are simple things but very important when it comes to home BP recording. So at this juncture, I would like to give myself leave, I have tried to illustrate some of the very important points regarding home BP monitoring, because simply because many of our patients, they stay far away, they may not be able to come to the hospital regularly for BP recording, and we depend on their BP record for changing, up titrating or down titrating the medicine. So the simple facts which we have illustrated, maybe they will help in they'll go in a long way in what you can say therapeutic management of patients with hypertension. Uh, Thank you.